Hi, so finally the delivery day has come. You must be so geared up. The anticipation, the excitement, it must be palpable within the family. But then there will be a lot of anxiety, stress. Oh, what's going to happen? So let me just solve the mystery for you. When we talk about deliveries, it can be either a vaginal birth or it can be a planned cesarean section. So let us first talk about vaginal births. Vaginal births can be spontaneous, that means you go into labor naturally, or they can be induced, that is, for whatever reason your gynecologist thinks that you need to start with labor pains on a particular day, and the admission and the process is carried out accordingly. So when you go in for vaginal birth, you must remember that you stay physically active. So during the first stage of labor, when the cervix is dilating, it is important that you move about and not just lie on the hospital bed. In fact, you can ask the nurses for a birthing ball and do birthing ball exercises. You need to stay calm and patient. Just remember that it takes a lot of time for the baby to come out. For first-time mothers, the period may be as long as 24 hours. And for second-time mothers, we expect an average period to be about 12 hours. Third, just check with the hospital what is the kind of diet allowed. Some hospitals will want to keep you fasting, some doctors will allow you liquids, some will give soft diet. So depending on the particular stage of labor you are and the condition, the oral requirements will be different and need to be checked with the hospital. In general, the rule of thumb is to allow patient orally, and at least the patient should take plenty of fluids. So you can choose the type of fluid that you want, maybe water, coconut water, tomato soup, depends on your taste. Fourth, check the pain relief options that are available in your chosen hospital. Whether you want to just go in for deep breathing techniques, or maybe when the pain increases, then you may want an epidural anesthesia. It is a kind of analgesia which is given in the bag, which actually dulls the sensation of pain, but the uterine contractions continue. In a well-selected patient, it is absolutely safe and it makes the patient relatively pain-free. Fifth, you can carry your own music, right? Anything which calms you, your own music, soothing talk. Check with the hospital what is the policy of the partner being inside the room, especially at the time of delivery. And last and the most important is trust your doctor. I am sure you have chosen your doctor with a lot of care. So trust in her experience and level of care. They will always provide tips to you on how to handle your labor pains. And when you are asked to push, then just push it. And then at the right moment, you will hear the baby cry. The other way to deliver is having a cesarean section. So cesarean sections can be elective cesarean sections, which are completely planned, which means that you fix a date and time of birth, and lo and behold, you get the baby on that particular date. Or it can be an emergency cesarean section, which means that you have opted for a vaginal birth, but during the delivery there has been some problem, like the baby's heart rate has dipped, or the baby has passed meconium, or you are getting pains but you are not progressing. So in such conditions, patients need an emergency cesarean section. So for a cesarean section, usually a spinal anesthesia is given in the bag. That means we give an injection in the bag which numbs the lower part of the body, but you are conscious during that particular period of time. This is done so that the baby does not have any adverse effects of general anesthesia and is the preferred mode of anesthesia for a cesarean section. Check with the hospital its policy about your partner being in the operation theatre and sharing that moment with you, or any photographs which can be taken and which can serve as memory for you for a lifetime. Next, check what policy they have on the cord clamping technique. So normally we will clamp the cord after the pulsations in the cord stop so that the baby gets enough blood. The other important thing at this particular time is skin to skin contact. so that the baby comes in your contact as soon as the baby is born. But remember, skin to skin contact cannot be done always. So it is more important for the baby to breathe at time. So if in a particular baby we are having a problem with breathing, we will ensure that the respiratory passages are clear before we initiate a skin to skin contact or breastfeeding on the table. After the Caesarean section, you will be moved out of the operation theatre in about an hour's time after we are sure that you are completely safe and can be sent to your room. So enjoy your D-Day, enjoy it without fear, without anxiousness, without nervousness. You have been through the 9-month journey. I am sure you have been well prepared for it. So let's just hear the baby cry.